And yeah, that's what I would like to do as I can continue in my birth work career to transition over to the education side. So,
Thank you for sharing. Next.
Good morning. My name is Kia Jones, and I am a mother of one. I had my daughter in 2018. She's 6. And before having her, I always knew I wanted to be involved in birth ever since I was a little girl. Knew I definitely wanted to go to school for it. I was a doula before I even knew what a doula was. I was in college at births, at one of my close friends' births, there for 12 hours with her, took care of her during pregnancy, during the birth, and postpartum. And so I became a doula in 2017. And then now I'm in the childbirth tract after having my daughter, or excuse me, childbirth education tract. After having my daughter, it definitely confirmed that this is the space that I want to be in. The goal is to go back to nursing school and then eventually become a certified nurse midwife. So I want to kind of go deeper and deliver babies in the future. But I'm definitely happy to have the childbirth education so that I can excel in my future when I do decide to go to school.
Thank you for sharing, Kia. Raven, I believe, is not here, so we can go to Shaya.
Greetings, everyone. I'm Shaya. I am a full spectrum doula. I've been doing doula work officially since 2016. And like Monica had mentioned in her introduction, birth work is very ancestral for me. It's something that's been in my lineage for years. And I got called to birth work through friends, inviting me to their births, asking me to come to their births. And I started to feel a responsibility even to learn more about what it was I was doing and to add knowledge and even certifications to the innate wisdom that I have. So that's how I got into birth work. And now I feel childbirth education. And while as a doula, we're educating families, I thought it'd be important to just double down on that education and create spaces to teach communities the best way to prepare themselves for birth, labor, and delivery. So it's very nice to meet everyone.
Thank you for sharing. And last but not least.
Good morning. My name is Matisha. I am a birth doula certified for the last 2 years and a childbirth educator. I have 3 daughters, very new empty nester. My youngest just started her freshman year of college just this month, actually. So just adjusting to life, as a empty nester. But as a doula, I have always had a passion for women and just a heart and just filled with compassion for people in their time of need. As a mother who during the birth of all 3 of my girls just experienced some things that because I lacked the knowledge and the skills to be able to advocate for myself, I felt like something was off, but I didn't quite know exactly what it is. And now that I know what it was that was off, I want to empower other women to, be able to advocate for themselves, to get a doula, because it's more available now so than it was at that time, but also just to empower the community. So just to talk about the importance of, just the life skills and the education part of it. So that's why I'm here, and I do thank you for this opportunity.
Thank you for sharing. And for our community members that are joining us today, if you would like to put in the chat your name and how far along are you, or if you're someone that's just joining for the education, we would love to know in the chat. And while you guys do that, we can go ahead and get started with the first section. If you want to go to the next slide. There we go.
Okay. Well, again, good morning, everyone. I just noticed on the slide it said it had my name listed as Monica Davis. I'm not sure who she is. I'm sure she's a wonderful person, but that's not me. I'm Monica Jones. So, what's happening in the body during your pregnancy? The first thing that's happening is what happens at conception. Your egg is fertilized by a sperm that is placed inside of, that is fertilized from the ovary and placed inside of the uterus, which houses the placenta, which is where your baby is held and grows. There are many changes that are going on in your body, hormonally, physically, all of these type of changes are occurring simultaneously. Your uterus changes. It expands. It's an organ that each and every woman is born with, and it expands significantly, and it grows to accommodate the growing fetus. It grows and it shrinks. It grows and it shrinks, and it is what holds the placenta, which carries the baby. It's an amazing organ. It moves upward into the abdomen by the second trimester. That's when we say that's when you begin showing per se. And during the latter part of your pregnancy, contractions may start as early as the second trimester through something that we refer to as Braxton Hicks. But your uterus is what is the powerhouse organ that holds and protects your baby and then expels the placenta from your body upon having birth. Another major change that happens in your body is through the cardiovascular system. All your bodily systems are changed during pregnancy. But what's particular about your cardiovascular system, which is your blood or your heart-based system, is that your blood volume increases by 30 to 50% to support fetal growth. With all of that voluminous blood, of course, there's weight that's associated with it. That's excess blood, excess fluid. So that is why it's very important, and we'll talk about that a little bit later, to make sure that you increase your water intake, because if you're not able to sustain that natural progression that occurs by making sure that you, as the birthing person, as the woman who is carrying this life, stays hydrated, then that blood volume or the lack thereof could potentially be problematic. These great cardiovascular changes lead to changes in blood pressure and heart rate of you and the baby. This adaptation helps provide essential nutrients and oxygen to the developing baby. So it's very important that you monitor your blood pressure, you take care of your body, and you listen to your body as you are growing this baby, this very important time during your life. Take time to exercise moderately. If you can walk or do some type of prenatal yoga or do some breathing or relaxing stretches, that's very important to maintain good cardiovascular health during pregnancy and beyond. Is essential. And I just wanted to also mention some things that I remember always being concerned about, not really having a good understanding of when we hear terms like prenatal, postpartum. Well, what does natal mean? What does partum mean? Natal is of relating to the time or place of one's birth or relating to the baby. And partum means after birth or as the mother recovers. So when you hear words like post, that means after. Postpartum is after giving birth. So again, natal, anything relating to natal is just about the baby, and partum is about the mother. So just to put those definitions out there, so when you hear them, you'll be a little bit more familiar with it. Another major change that happens on the inside of all of our bodies are shifts in hormones like HCG, which is the hormone produced by the placenta during pregnancy. Progesterone and estrogen, they both work together. They're on the rise, and these hormones affect your mood and everything that is going on the inside of your body. Estrogen and progesterone work together to prepare the body for pregnancy and sustain it. Estrogen helps the eggs mature in the ovaries, and progesterone prepares the uterus for implantation and nourishes the uterine environment. Progesterone also prepares the breast for milk production. So as you are expecting as your abdomen is spreading, you will also notice changes in your breast and other areas of your body. And it's because your body is preparing to lactate to be able to produce milk and nourishment on the inside, from the inside. So upon upon childbirth, if you so choose to nourish your baby in that way, your body will have taken the hormones working inside of your body will have taken that long period to prepare itself and gradually prepare you for birth. These hormonal shifts that you'll notice can also cause morning sickness. Sometimes that's a misnomer. It's not just morning sickness, but all day sickness for some people, or just changes in your appetite, fatigue, emotional changes. All of these things are absolutely normal. We all experience these changes. No matter if this is your first baby, your fourth baby, your 10th baby, everyone experiences these changes, especially emotional changes. And all of them are due to these great hormonal shifts that are taking place on the inside of your body. It's very important to be mindful of this and not be afraid or ashamed of these things, because they're very natural components of being pregnant. There's also musculoskeletal adjustments that come along with being pregnant, such as your ligaments and joints becoming more flexible due to the hormone relaxant, preparing the body for childbirth, but potentially causing discomfort and instability. So we have to have the hormone relaxant working on the inside of our body to be able to make the shifts that need to take place to open ourselves up or loosen our ligaments so that we may be able to make room for this growing, the weight gain and this growing abdomen area that we're carrying this baby. But have you also noticed, or if you heard, that your feet may grow or stretch out? Some people say your arches fall when you're pregnant. All of those things, normal. This is because of relaxing. Your body becomes softer, and sometimes just things that may have looked or appeared a certain way may be a little bit more softer and looser, and that's because relaxing is at work and it's doing what it's supposed to do. After, in the postpartum period, sometimes these things go back to what is similar to before you were able to conceive, but in many cases it may not completely. In some women, it may not completely go back. There's some people's, for instance, their feet, because of the active hormone of relaxant, their feet may become looser and wider, and they may not go back to their previous size. And again, these are all normal and common things that occur during pregnancy. And so with any of my other childbirth educating cohort mothers, women would like to chime in on this section, I welcome anybody's input. Anybody else from the cohort want to add anything? No? Okay. Well, if we can shift over to the next slide. Next. Okay. What is the purpose of childbirth education? Why do we need it? Why do we need education at all? It's just something that's going to occur. We could just look it up or determine everything that we need on YouTube or TikTok or whatever social media. Childbirth education is very important. One of the reasons why it's important, or the purpose of it, is to empower expectant parents with the knowledge about the labor process, pain management options, and postpartum care, helping them to make informed decisions. So it's all about empowering you with the knowledge to help you grow as a parent and as a person. Some of the key topics that we'll be covering include labor stages, pain relief options, breastfeeding, newborn care, and parental mental health. These classes also offer strategies for self-advocacy and informed consent during labor, and they also are beneficial in supporting connections and network. Education emphasizes the importance of a strong support system, including partners, doulas, and healthcare providers, fostering a team approach to birth. So no one should feel that they are birthing alone. No one should be alone while they're giving birth. It's so important to have a partner, to have a doula or some support person to help you feel supported and guided along the way. And you get all of that information and support through being informed, through classes, through childbirth education, and through even having your support person hear some of the things that you are being exposed to, or employing a doula to help along the way so that you can feel confident around everything that your body is experiencing during this very special time. Childbirth education is something that everybody can benefit from, no matter the amount of children that you have. There's always something to learn because every experience, every birthing experience is different. So one little nugget of information as it relates to this childbirth or this experience can help along the way. So it's a very, very important thing to have. And I commend each and every one of you who are attending the class today that you've taken the time out to educate yourself on the importance of childbirth. So there's really nothing that is taboo or can't be asked. If there's anything that you want to know, your doula, your educator can be able to answer that. And in the event that they can, or if it's beyond their scope, help you find the resources to be able to answer whatever question, issue, or concern that you may have. But there's nothing new under the sun. We've all experienced it, and there's nothing to be ashamed or embarrassed about. So that's what education is for, to learn, to glean, to grow, and to share. Next slide. Okay, now we're going to talk about the anatomy and different stages of the baby in the womb. We're going to begin in the first trimester. During the first trimester, it is very important because that's when major organs and systems begin forming. By the end of the stage, the embryo is called the fetus, and all major body structures are already in place. So by 12 weeks, all of your major systems are already in place. So it's a very important time during the growth and development of this growing baby, that this growing fetus on its life's path. It's also a very important time to begin taking prenatal vitamins or supplementing, being very intentional about the nutrition that you are intaking during the first trimester, because as I said, your brain, all other bodily organs and systems are being developed during the first trimester. During the second trimester is when the fetus grows rapidly, developing reflexes, and the gender becomes easily identifiable. The placenta fully supports the baby with nutrients and oxygen. So nutrients and oxygen all come to the baby through the placenta, through the umbilical cord during all portions. But it's very important that nutrition is considered of utmost importance, especially beginning during the second trimester. The first trimester usually is when it may be somewhat difficult to handle the great hormonal shifts that take place on the inside of the body because of the hormonal changes. Many women experience nausea or morning sickness, and they may have very limited ability to eat or keep foods down during the first trimester. But usually toward the latter part of the first trimester, toward the second trimester, your body begins to adjust to these hormonal shifts, and you can begin eating more and enjoying your food a little bit more. Your energy comes back. Generally, you have the most energy during your pregnancy, probably during the second trimester. You are showing by this time. You're usually, it's quite evident that you are expecting. You can still move, still get around pretty comfortably during the second trimester. So it's sort of like the golden period during your pregnancy, during the second trimester. Then the third trimester is when, again, the fetus is pretty much fully developed during the third trimester, and it just continues to gain weight and prepare itself for birth with significant brain development and lung maturation. So the brain is there, it's already there during the first trimester, continues to grow during the second trimester, but that's really the impactful portion or the most rapidly changing portion is when during the third trimester, when the lungs are being developed. So that's when many babies that may be born prematurely, those extra days really do matter while in utero, to make sure that we are able to develop the baby as most completely as possible. During the third trimester, the baby oftentimes turns head down in preparation for delivery and in preparation to leave his or her home and be introduced to the world earthside. Anatomical support for this baby includes the placenta, the amniotic sac, which is where the baby is housed, that liquid, watery environment where the baby is housed, and the umbilical cord, as we mentioned before, are the three vital structures that nourish and protect the baby throughout pregnancy. So there are some people who say some old wives' tales, you need to take it easy, you don't need to do anything during your pregnancy, but sit down. There are different things and different factors that affect different mothers at different times. For instance, if you're having multiples, if you are if you have some pre-existing conditions, if you have an advanced maternal age, which means if you're 30, 35 years old and up, if there's some just any other conditions, all these things are to be considered during all portions of your pregnancy, and you should discuss this with your care provider as well as your support person. But most importantly, listen to your body, listen to your baby. When you have scheduled prenatal appointments, to do attend those appointments, making sure that everything is developing as it should. And if you detect any changes during any portion, especially during the third trimester, be sure that you reach out to your provider. It's important during the third trimester to count the kicks, to make sure that you listen and pay attention to the baby moving on the inside of you. If you've noticed any changes at any point, but especially during the third trimester, to report those changes immediately if you notice any changes in your body. Going back to the hormonal shifts, another thing that I wanted to mention is as it relates to changes in your skin. There's oftentimes changes in the color of your skin, or the just different changes in your skin. Some people experience stretch marks. Again, this is normal and common during pregnancy, but it is imperative to take care of yourself during pregnancy, to keep yourself hydrated, to keep yourself moisturized, to keep your skin moisturized, to pay attention to how you're feeling and what is going on the inside of you and on the exterior. Changes do happen during pregnancy. That's the beautiful part about pregnancy. And again, there's nothing to be ashamed about when you do experience these changes, but it is important to take care of yourself and make sure that you do stay hydrated, stay nourished, and do protect your body and skin throughout all portions of your pregnancy. Some symptoms that you may feel as we're going to break down each trimester. During the first trimester, as I mentioned before, very common symptoms include nausea, fatigue, breast tenderness due to hormonal changes, and emotional fluctuations are very typical as the body adjusts to pregnancy. These things, you feel like you don't know what's going on with you. You've never felt these changes before. They're normal, but it's normal to feel different during pregnancy. All of these things are absolutely normal. To combat some of the mood swings and some of the changes and some of the hormonal shifts, it's important to maintain your nutrition and to eat at regular intervals. Sometimes to combat morning sickness, you may have to eat bland foods, stay away from things that are extra spicy or extra greasy, because that can exacerbate nausea and make you feel even less likely or less comfortable in eating, because that can cause an endless cycle of going back and forth. So eating small meals that may be a little bland, such as crackers, bread, just to keep something down so you can feel somewhat satiated, is important during that first trimester. Or even skipping things, eating altogether, and drink your nourishment until your nutrients, until you're able to get the nausea at bay. It's an acceptable thing. Whatever you need to do, again, talk to your provider about it. But understand that these shifts and these changes are absolutely normal. During the second trimester, your symptoms typically ease. You do generally have an increased energy levels, but new symptoms, I didn't mention this, such as back pain, round ligament pain, and skin changes. We mentioned that also darkening of the nipples may occur. You usually begin to feel the baby's first movement, also known as quickening, during the second trimester. You usually can feel the baby moving very well by the third trimester. You know that there's a baby there. You can feel it as evidence, and you can even see it in many cases. If you look down at your belly and you can see the baby moving, or you will laugh and you'll feel the baby moving, or you'll eat something and the baby may respond to what you're eating or drinking if it's very cold, or you may feel the baby having hiccups, things of that nature. All these things happen beginning in the second trimester and are definitely there by the third trimester. Increased discomfort during the third trimester is absolutely normal during a growing uterus. Take your time with yourself, be patient with yourself, don't move too abruptly. It's okay. You are holding life on the inside of you. So it's not a marathon, it's not a sprint, it's a marathon. It's a 9-month marathon. So take your time, be patient with yourself, and loving towards yourself during this very special time. Some people experience heartburn. They say sometimes you have heartburn, and that's evidence of a baby with a head full of hair. That may or may not be true, but some people can testify to it. You may experience shortness of breath when you're walking or doing daily activities, as well as some swelling in your hands and your feet. Some people experience their hands swelling. They may have to remove jewelry from their hands, and their feet swelling. They may not feel as comfortable standing on high heels. So you may just have to wear something that's flatter or more stable to you. With your back, all of these things are common during the latter portion because your weight is expanded and your equilibrium is off. So it's very important that you're mindful of this, that again, you take your time, you don't rush yourself, and you're able to allow your body to move at its own pace. Braxton Hicks contractions, which are those preliminary contractions, letting you know that your body is preparing for birth, generally increase and intensify during this time, and sleep disturbances are quite normal. It's very important to be mindful to sleep on your left side during pregnancy. Sometimes a birthing pillow, a pillow between your legs, can help with the comfort or discomfort that you're experiencing during this third trimester. And sometimes you may not even feel comfortable in bed at all. You may feel more comfortable sitting up in a chair or sitting up on your couch and sleeping that way. Again, because of the hormonal shifts, because of the weight gain, you may feel very hot during this trimester. You may feel that you need to have a fan on at all times, and all of these things are absolutely normal. You're glowing, you're beautiful, but do be patient with yourself and try your very best to keep yourself in a very happy space, because your unborn baby can feel and sense your emotional state. So being mindful of that, being mindful of your environment, and trying to be as positive as possible during this very special time is crucial. Emotional preparation for childbirth, again, is crucial. Making sure that your support is the people who you surround yourself are supportive of you is essential. If there are people that you encounter that are not supportive of you or your pregnancy, it is okay to limit your interaction with those people, whether it be your family members, with people in your work environment. It is okay to keep any negativity at bay during this time, especially, but during life in general, but during this time especially, because again, this unborn baby can and will respond to your emotional state. So it's so important to make sure that your community is there for you, understands you, and is supportive of you. Any questions during this time? Okay. Next slide, please. Patient rights. Okay, so many of us have a need to understand our rights as a patient during pregnancy and childbirth, and just in general. Each of us have rights, but we may not be aware of our rights, but it's important that we know that we do have rights as a pregnant person. The first right that I'll discuss is a right to informed consent. Every patient has the right to be fully informed about the risks, benefits, and alternatives to any treatment or intervention during pregnancy and childbirth. This includes the right to decline or accept procedures. There's an acronym that we like to use to help us understand our rights or remember that we do have rights. And that acronym is BRAIN, BRAIN. The B in BRAIN stands for the benefits. If you're concerned about a procedure that you are presented with during pregnancy, the first thing that you can do is ask what's the benefit. Ask your provider, how is this beneficial to me? Feel free to ask as many questions so that you can have a good understanding of its benefits and its drawbacks or risks. What are the risks of this procedure that's being done? And keep asking questions until you have a full understanding of it. The A in BRAIN are alternative options. If there are any alternative options, ask when and how that can be done. And then the I in BRAIN is for intuition. Follow your gut feeling. What is your gut telling you about this procedure, this situation that you're presented? And then the N is nothing or wait. What happens if I do nothing or wait a while before I make a decision on this procedure? So again, the acronym that we want to keep in mind is always use your brain. Consider the benefits, be mindful of the risks, take time to understand the alternatives. Check in with yourself, with your gut feeling. What does your intuition tell you? And what happens if I do nothing or wait? Benefits B, risks R, alternatives A, intuition I, nothing N. And dignity. All patients deserve respectful care that upholds their dignity, regardless of race, ethnicity, socioeconomic status, marital status, and any other type of demographic that we coercion. There's also a right to make decisions. You have the right to make decisions about your care based on your personal values and beliefs. This includes the right to change your mind at any point during your care. Up until the time in which you have your baby, you have the right to change providers, to change locations. Within a system, to change the person who is attending to you, you have that right as a patient. Even upon having your baby, you have the right to change whoever you would like to see during your postpartum period. You have that right. You need to know and embrace your right and never forget that you do have choices. It is your decision on how your care and where your care will take place. You also have a right to privacy and confidentiality. Your health information should be protected, and you have the right to privacy during all your medical examinations and procedures. If there's something that you ask for that is refused, I encourage each and every one of you to make sure that you ask the attendant upon your question being asked or something being refused to put that information in your chart, to write that down. And okay, how to make and advocate for yourself and make informed decisions. We talked about these things. Ask questions, always bring a support person, know your birth plan, and trust your instincts. Now, I've discussed about asking questions, and bringing a support person. Your support person could be your partner, it could be a sister, a mother-in-law, or it could be your doula, whoever it is, but make sure that you do have at least one support person that is aware of your desires and your of what it is and how it is you like your birth to go. And knowing your birth plan. What is a birth plan? A birth plan is nothing more than a written document that outlines your desires for birth. Generally, it's between 1 and 2 pages. And in that plan, some key essential components are being able to identify the people that you would like to have in your birth space, the environment that you would like to have, where you would actually like to give birth, in, if given the option, in a bed, in water, at home, however way you would like the environment to be, what type of pain relief that you would like to have, what is what is important or what is comfortable for you as it relates to a massage, if you would like to have an epidural, whatever type of pain relief that you would have or what is available to you at that place, that needs to be included in your birth plan. What position you would like to have your baby in, whether you want to be able to move around freely beyond your hands and knees. All of this is contingent upon your preferences, your condition, but it is important to mention these things before giving birth with your provider. And what procedures you would like to have done in the postpartum period, what procedures you accept for your baby. Generally speaking, all babies are given eye drops in the form of erythromycin. All babies are given a heel prick to ascertain any abnormalities that are common in babies. They're going to test that, and they're given a heel prick upon giving birth. All babies are given a vitamin K shot, and this is what goes on in the hospital, as well as a vitamin K, a hepatitis B shot. And a vitamin K is to promote blood clotting in babies that could be occurring if you choose to have circumcision, or that is a preventive measure for potential of a brain bleed. That is the purpose of the vitamin K shot. Hepatitis B is to prevent the transmission of hepatitis B. The erythromycin is to prevent the baby from getting any type of infection in his or her eyes. It's antibiotic drop. And then again, I discussed the heel prick, which is the state measure to determine if there is some type of congenital or any type of disease that may not be known initially, to check for that type of abnormality through the blood test that is done. Each of these things you can discuss with your provider or place in your birth plan if you would like that to occur. If you would like to have skin to skin immediately after, if you would like to nurse your baby, or how you would like your baby to be fed, that should be included in your birth plan, as well as after delivery. The details of when and how you would like your baby to be bathed, if you would like to room in with your baby, or if there's a nursery, if the baby would be able or eligible to go to a nursery. All of these things should be discussed and written in your birth plan. And finally, we talked about trusting your instincts. If something doesn't feel right, feel free to speak up. You have the right to request a second opinion or change your care provider if necessary. Next slide, please. In terms of resources and support, it is very important to determine, I think one more slide over, to look for organizations that specialize in providing care and support. Oh, okay, yep, you can go back a slide. I'm sorry. Look for organizations that specialize in providing care and support tailored to your cultural and linguistic needs, such as Black Mamas Matter Alliance or Indigenous Women Rising. Just go around people that you feel most comfortable with, that you understand, and that they understand you. It's very important to have culturally competent care that's respective of you as a person, your partner, your lifestyle, whatever it is that you stand for and you mean. You need to feel embraced by whomever your care provider is and their organization that is providing care. If not, keep seeking organizations, people, and providers that do align with your beliefs, with your system, and will support you 100%. It's also encouraged to connect with local or online groups where you can share experiences and gather advice from others who understand your cultural context and lived experience. There's no substitute to face-to-face interaction, but if there are some online groups that you feel comfortable being around and sharing your story with and sharing your information with, that is a very important tool that you have. But again, there is no substitute to hands and feet being there for you and being around people in your community that do support you. Black Mamas Matter Alliance is another good one that was just posted in the chat. So know who your support, know who your community is, know who your tribe is, and seek out ways in which you can gain information from them, but being able to actually interact via phone call or face-to-face with someone literally in close proximity to you is very important. Postpartum Support International is also a support group. HOPE, H-O-P-E for Georgia Moms is another good support group that you can reach out to. So there are groups around and there are people who are willing, ready, and able to support and help you. Please don't ever feel like there's no one there. Help is just a phone call away. Just La Leche League for those people who may be concerned or interested in breastfeeding. Mothers will be able to come out and support you during your postpartum period as you become acclimated to being a nursing mother, or even during your pregnancy. There are resources available, and there are people whose whole heart and desire is there to help and support you. That's their whole goal. So never feel, Rose is another organization, Reaching Our Sisters Everywhere. They're a great support group to support birthing, to support lactating families, supports mothers and fathers who are providing breastfeeding to women in the African American community primarily, but not exclusively. So now we can move on to maternal nutrition. Next slide, please. The importance of maternal nutrition cannot be understated. It is actually the foundation for fetal development. Proper nutrition is absolutely crucial for the growth and development of the fetus. Essential nutrients like folic acid, iron, and calcium are vital for the baby's brains, bones, and overall growth. So it is, yep, Rose and Roll, Reaching Our Sisters and Brothers Everywhere. Thank you so much for that. It is absolutely important to maintain, to prioritize making sure. Atlanta Birth Center, Mocha Moms Breastfeeding Support Group is another one that was just mentioned. To maintain optimal nutrition is very important for both you and your baby that's developing on the inside of you. We want to make sure that we do everything that we can to promote healthy growth and development, as I mentioned, of the baby's brains, of all the baby's internal organ systems, of the bones and overall growth. And to do that, most ideally, is through proper nutrition. A balanced diet helps prevent pregnancy complications like gestational diabetes, preeclampsia, as well as anemia. It also supports the mother's immune system and overall well-being. Some key foods that are important to be mindful of. Oh, okay. Long-term health impact affects maternal nutrition, not only affects the pregnancy, but also the long-term health of the child. influencing their risk for chronic conditions such as obesity and heart disease later in life. So what you do while you are expecting can set your child up for a lifetime, or prepare them for a lifetime of health or a lifetime of not so ideal wellness. As you are carrying your child, what you put into your body, everything that you eat does pass through your body, and then through the placenta, through the umbilical cord to your baby. So it is so important to be mindful of what you eat, to drink a sufficient amount of water, to stay away from large amounts of alcohol. Some people say absolutely no alcohol during pregnancy. Try not to be around any type of smoke. Try to prevent any type of potentially negative environmental things that you can prevent. Also, aside from nutrition, being mindful of chemicals that you clean with during pregnancy. It's imperative that you be careful that you're mindful of your body system, of your skin also being an organ, and what you touch from your skin those chemicals can transfer into your baby. The medications that you do take, that you're prescribed, be sure that you tell your care providers that you are pregnant or upon having the baby, breastfeeding, because those chemicals that are in medications that you need for yourself may or may not be beneficial to your baby. So being mindful of everything that you take in, of also the pre-existing conditions that you may have. You may need to fortify your body in specific areas, but generally speaking, one safe rule of thumb is eat plenty of vegetables and fruits and vegetables as much as possible. Drink plenty of water. Be mindful of whole grains, of lean proteins, whether it's an animal protein or a plant-based protein. Being mindful of dairy or fortified foods. Some foods are fortified with folic acid or folate that will benefit your baby's brain development, and also being mindful of healthy fats. So sometimes we have been told that because you are pregnant, you can eat for two, you should eat twice the amount of food that is recommended. That is not necessarily true, as long as you are eating an adequate amount of calories, depending on your pre-existing weight, or what it is that you're carrying, or how you're existing. Your dietitian, your doctor, or perhaps even your nutritionist can help you specify a diet or a nutrition path that is most ideal for you in particular. But the overall summation or takeaway from this section is that you actually are in control, and you have major control over how you set your child up because of what you do and or don't do during pregnancy, based on your nutrition and what you take in. So it's no light matter. It's a very important and it's a very significant benefit for both you and baby to be mindful of the foods that you take in, and your environment in general, the chemicals that you take in, even something as simple as changing cat litter, being mindful to wear gloves, or even pass that on to someone else, because I have lived experience of having contracted toxoplasmosis, which is a parasite that entered my body through my skin. I was a child at that time, but it was due to being exposed to cat feces. So it's a real thing that you should be mindful of. Making sure that if you do eat meat, that your food is well cooked, that you make sure that is another measure to keep down any food-based pathogens that could pass into your body and could be detrimental toward you and the baby. So just make sure that you're very careful about what you take in. There's so many different diets and different food choices that are available today. And I'm by no means suggesting one over the other, but just generally speaking, being mindful of the food that you take, Local foods, organic foods are more ideal than those that are non-organic. Fresh foods are more ideal of things that are in the can, because that can add sodium, unnecessary sodium or unnecessary sugar to your diet. Just being able to eat as fresh or close to as fresh as possible, and eating throughout the day, and not allowing yourself to get too hungry, or just being able to keep yourself nourished during this time period, being mindful of the calories the sources of the calories in which you take in, that you want to eat well throughout your pregnancy. I think, okay. We talked about leafy green vegetables, rich foods that are rich in folic acid, which help prevent neural tube defects and supports the placenta. Whole grains provide essential fibers, B vitamins, and sustain energy, supporting both mother and baby. Lean proteins are essential for fetal tissue growth and maternal muscle maintenance, especially from food sources such as beans, legumes, lentils, and fish. Fish, not all fish, that are low in mercury. Dietary or fortified alternatives, which are crucial for calcium and vitamin D, promoting strong bones and teeth in the fetus. So yes, we are promoting bones and teeth before the baby is even born, because of what we eat during pregnancy. And healthy fats that provide omega-3 fatty acids from sources such as salmon, flax seeds, and walnuts are vital for fetal brain development. So we want to have our babies have everything that we can possibly have, to what we can do to provide them what they need to have optimal development upon entering Earthside. It's also important to be sure to encourage the inclusion of culturally relevant foods, some foods that we may eat in our culture, other people may not eat or be familiar with. For instance, in my culture, we eat lots of okra. Okra is one very beneficial food during pregnancy, especially during the late postpartum period, because its mucus-like texture. That is something that has been deemed to be beneficial during the third trimester, to prepare the body to be able to easily expel the baby, because of that consistency of that food. Another legume that is cultural, specific to my culture, to our culture, is, for instance, black eyed peas. That's something that is wonderful for growth and development of the food. So foods that are indigenous to your particular culture, or your ethnic group, is something that can be embraced during this time and celebrated, because there's food all over the earth that is indigenous to all of the different cultures, that have helped mothers since the beginning of time give their children the proper nutrients that they need during their pregnancies throughout the year. So being mindful of those foods, and embracing them and celebrating them during your pregnancy is very important and beneficial to both you and baby. But of course, again, if there are any alternatives that you see or deem necessary based on your dietary preferences or restrictions, be mindful of that and adhere to that. So whatever it is that you need to be mindful of, whatever it is that you may already have some type of deficiency in, that's fine. Just be mindful of that, and work around that in accordance to that. So some common dietary concerns and how to address them. I think that's the next slide. I think there's one more slide. Okay. Oh, okay. Morning sickness, as we mentioned before, suggest small, frequent meals with bland foods like crackers or ginger can ease nausea. Also encourage hydration and consider vitamin B6 supplements if needed, but we have to consult a healthcare provider for that. Gestational diabetes, emphasize I want to emphasize the importance of low glycemic foods such as whole grains, beans, and non-starchy vegetables to help manage blood sugar levels. Basically, not foods that don't let your blood spike or have major shifts in your blood sugar that your body can break down slowly, such as eating oatmeal over eating a sugary cereal. So it maintains your blood sugar instead of bringing your blood sugar up and then having it drop. So things of that nature, not using an unnecessarily large amount of syrups or sweeteners in your foods, because your blood sugar will spike and then go up and then go down. And the baby is experiencing the same shifts that you're experiencing. So being mindful of that, eating slow foods is probably a safe way of slow foods are probably safer, or fruits in its natural states are probably safer bet than highly processed foods during this time and just in general. There's another consideration such as iron deficiency is very, very common during pregnancy. Some recommendation of iron-rich foods are spinach, red meat, liver in particular, calf liver, beef liver, chicken liver. Some people even eat pork liver. In the form of liverwurst, and legumes, again, paired with vitamin C foods such as citrus foods to enhance absorption. So it's important that if there is an iron deficiency that you're mindful of, ask your provider, how deficient are you, what your levels are, and then modify your diet and or take iron supplements along with vitamin C to encourage your body to absorb it. So iron and vitamin C work in tandem so your body can properly absorb it to benefit the baby. And then upon modifying your diet to ensure that you have received or you are doing what you need to do to increase your iron and your vitamin C content to aid in absorption, have them to test your blood again to determine if you have if your iron levels have indeed increased. And you should be able to see benefits once you have made those modifications in your diet. Another consideration is to address potential barriers to healthy eating, such as food insecurity or limited access to culturally preferred foods, and also to be mindful of resources that are available for assistance. There's a program that is available called WIC, Women, Infants, and Children, that can provide food support while you are pregnant and during your postpartum period. It's a different amount during your postpartum period, whether you are breastfeeding or you're bottle feeding of different amounts of foods. But up to age 5 for your baby, this program, Women, Infants, and Children, that's available throughout the state, that is income contingent, can provide support. And there are plenty of food resources that will be more than willing, able, and ready to help expectant parents to have the food support that they need in the event of any type of food insecurity. So don't be afraid. There is no stigma, there is no shame that is associated with needing extra help during this very special time. Again, Georgia is rich with resources, it's ripe with resources. Take advantage of the resources. If you have an abundance, share your abundance, but make sure that you have what you need during this time and reach out for help. We're here to help you. We're happy to help. There's so many resources that are available, and we just want to make sure that what you feel that you need, based on what you know and based on what your healthcare provider tells you, that your needs are met. Thank you so much for your time. I will hand it over to the next presenter. Are there any questions? Hearing none, I'll pass this over to the next presenter. Thank you.
Thank you so much, Monica. Holly, you can actually stop sharing your screen. Thank you. And if any of the mamas on the call, if you want to come off mute or put in the chat if you do have any questions, I know it's a lot of information. Please feel free. Kia, you should be able to share your screen. Perfect.
Okay, are you able to see it?
Yes.
Okay, let me, give me 1 second. Uh-oh, I didn't mean to do that. Okay, and then let me just zoom in.
You'll have to go to the, oh, yep, you could do it that way too.
Okay,
If you want it to be bigger, you'll have to use that thing in the right corner.
oh, present.
Oh, yeah, your present is there. Sorry, earlier it wasn't there. Yep, that's fine. Perfect.
Okay. Let me actually go back to the first slide.
Yep.
Alrighty. Okay, so I will be talking about your birth setting and your team. And so your birth setting and your team is really important. The certain points I wanted to talk about when it comes to your birth setting and your team, and I'm sorry, my video is not on, so let me go ahead and put it on really quick. There you go. So what I wanted to talk about when it comes to the birth setting and team, the people you choose and the place where you give birth, they do play a crucial role in your childbirth experience. A well-chosen birth team and setting can also contribute to a safe, supportive, and empowering experience. And then understanding your options, they help you to make better informed decisions that align with your values, preferences, and cultural backgrounds. Okay, so next we'll talk about your actual, it's going so fast, who's on your birth team. So I'm going to go into discussion about each member of the birth team. So first we'll start with your obstetrician or your OBGYN. So an OBGYN is a trained doctor who specializes in pregnancy, childbirth, and the female reproductive system. So if they are just like the OB pretty much stands for the doctor who focuses on the pregnancy and childbirth, while GYN is the doctor who is focused on the female reproductive system. So that you can have someone who has the title of an OBGYN, or they can just be an OB who is an obstetrician who just focuses on pregnancy and childbirth. So the OBGYN, they have a medical degree with at least 12 years of education and training. Anyone can see an OB for care. Okay. They mostly specialize in high risk pregnancies. Like I said, they can see anyone, but they are specialized in caring for high risk pregnancies and surgical births. So, like C-sections. If you're having a C-section, only an OB can do that because they are trained to provide do C-sections. They are also ideal for those needing or preferring a medically managed birth. And so next would be a midwife. So the difference between a midwife and an OBGYN, they are both medically trained, but the OBGYN has a medical degree, while a nurse they're different types of midwives, and I'll go into that in a second. But midwives in general are trained healthcare professionals who provide care for women during pregnancy and childbirth. Usually they focus on low risk pregnancies and natural or non-medicated births. Midwives often provide personalized care and support during the birth. And so there are different kinds of midwives. So the first midwife I wanted to talk about is the certified nurse midwife. These are the ones who are registered nurses. So they have a bachelor's degree in nursing, and then they have a master's degree in midwifery. So these are the ones, they can be in the hospital. They can actually prescribe meds as well. Although I mentioned that most midwives, they focus on non-medicated births. They also can prescribe medications if you wish. They can take high risk pregnancies. Usually they don't, but if they do, they are always partnered with an OBGYN. And so the OBGYN would be a part of your birth team if you are high risk, but you choose a midwife. So they'll be working together. A certified nurse midwife can also provide care in all settings, and they can practice in all 50 states and DC as well. So they're legal in all states. There's also a title of the certified midwife. So a lot of people don't know about this midwife. They are non-nurses with a master's degree. The only caveat to this is they can only practice in 12 states in DC. So Georgia is not one of them, but I thought I'd just throw that out there so everyone knows that there are different kinds of midwives out there. And then you have the certified professional midwife. So these midwives are certified from apprenticeships or educational programs accredited by the Midwifery Education Accreditation Council, or also known as MEAC. They practice in 36 states as well as DC, Washington, DC. So for the certified midwife and the certified professional midwives, those are the midwives you kind of want to do your research on, see if they're legal in your state, and see what the regulations are per state. But like I said prior, midwives are what people usually choose if they're looking for just kind of a natural birthing process. If you are in the hospital, you can check with your hospital to see if they have certified nurse midwives. They do hire them, but they can be in all settings. And then next, where you have your doula. So a lot of people get midwife and doula confused. As a doula, I'll tell somebody I'm a doula, and they'll be like, "Oh, so you deliver babies?" No, I don't. So it's definitely a different title. So doulas, they provide non-medical care, and they can become certified through a doula training program versus actually going to a master's program or an actual midwifery school. And so, like I said, they're doulas. They're strictly doulas, go to a doula training program. They provide emotional, physical, and informational support before, during, and after birth. And so doulas advocate for your birth preferences, and they help you navigate your options. And usually, if you have a doula, you'll see them for 1 to 2 prenatal visits. And during those visits, they'll answer any questions you may have, go over your birth plan, and provide you with any resources that you may need. They also support you during your birth. So they'll be at the hospital or birthing center or wherever you choose to have your baby. And the good thing is a lot of hospitals are starting to integrate doulas into the birth team. So before you really wouldn't see a doula, but now doulas are really starting to be in the hospital and provide that support for you. And they're a part of the birth team. And then after you have your baby, doulas also will see you for your postpartum during postpartum. And so sometimes they'll do 1 to 2 postpartum visits just to check in on you and the baby, see how you're feeling. Some doulas help with lactation. Some doulas may help with housework. So maybe do dishes, clean up, watch the baby while you and your partner sleep. So, a lot of research to do to see if that doula is able to provide that certain amount of care you're looking for during postpartum, because not all doulas may provide those services. So just check in with your doula, see if they're able to provide those services. They also have something called sibling doulas that will help with if you have multiple kids, they'll help with the other children as well while you get acclimated with the new baby. And then we have the nurse. So L&D, labor and delivery nurse. So nurses have a bachelor's degree in nursing, And they are the ones that manage the medical aspects of labor and delivery in a hospital setting. So usually they're the ones to monitor you and your baby's vitals. They will administer medications as needed, and they also provide support. So if you don't have a doula, sometimes the nurse may be that physical and emotional support that you may need. But a lot of times, they have multiple patients versus the doula. They really are focusing on you and you only. And so the nurse may not be able to provide as much support as you would wish, but they can if they have the opportunity to. And then we also have your pediatrician or neonatologist. So these doctors, they're trained doctors who specialize in the care of your baby. The difference is the pediatrician, they focus on the entire health of your baby, just like the neonatologist, but the neonatologists are more of like a specialized pediatrician. They focus on premature babies or babies that have any kind of health problems. They both have a medical degree and at least 12 years of education and training. And then the neonatologists, they do start as a pediatrician, but they receive that specialized training in neonatology. And a lot of times, if you have a C-section, the pediatrician or the neonatologist will be in that operating room. And when that baby comes out, they're right there. And then they basically, as I mentioned, ensure your baby is in good health after birth, especially in a hospital setting or if special care is needed. And then another part of your birth team I wanted to talk about that's not on the slide is your birth partner. So you don't want to forget about your birth partner. It can be your significant other, your spouse, a relative, a friend, etc. And so they provide emotional and physical support as well, just like the doula does. And a lot of times the doula will work with your partner to provide education on how they can be involved during the birth. So they'll help with like comfort measures, and then how they can kind of get the environment ready for you during birth. So they're kind of like an extra doula in a way, but it's always good to have a birth partner as well, and we collaborating with the doula. Any questions on your birth team before I go to the next slide? Okay, so next we'll talk about finding the best birth setting. And so choosing the right birth setting is important as it will align with your birth plan and your needs. So first we'll talk about the hospital. And so the hospital, they offer the most medical support and interventions, including pain relief options and emergency services. The hospital is ideal for those who prioritize access to advanced medical care. So that includes high risk pregnancies. If you know you have to have a C-section, you're going to have it at the hospital. If you know that you want to have a medicated birth medicated birth, if you want an epidural or you want any kind of pain medication, you're going to have to get that at the hospital. All of the care team will be at the hospital. So you'll have your OBGYNs, your pediatricians. Like I said, hospitals are starting to integrate doulas into the birth team. You'll definitely have your nurse. And then some midwives will be at the hospital. You just need to check with your hospital to see if they have a midwife. And then so next will be a birth center. A birth center provides a home-like environment with a focus on natural birth. Birth centers offer a middle ground between home and hospital birth, often with midwives as the primary caregivers. So this is where you'll see your certified nurse midwives. If you're in those 36 states that certified professional midwives practice, they may be there as well. They do not provide medication. So again, you will have to get that at the hospital. If you want a medicated birth, you need to go to the hospital. Some birth centers do provide nitrous oxide, which is laughing gas. You may hear about that when you're at the dentist. If you need to get a cavity filled, they provide laughing gas. So it's the same thing. You would want to check with your birthing center first. I do know that Atlanta Birth Center, I believe they provide nitrous oxide. And so check with your birth center to see if they have that option available. Mostly at the birth center, when it comes to pain management, they do things like massage, hydrotherapy. So that's getting in the water to ease those contractions. They may offer a TENS unit, which is a device that delivers electrical impulses to nerves underneath your skin surface. So it may help with the pain during contractions. And usually low risk pregnancies will be at the birth center. Again, high risk pregnancies, they need to be at the hospital. Birth centers are not really going to provide care to high risk pregnancies, because if something goes wrong, you need to have medical care on standby and you need to be in that hospital. And then finally, we have a home birth. And a home birth allows for a familiar, comfortable environment with personalized care from a midwife. Sometimes a doula will be there, a birth assistant, which I didn't talk about when it comes to your care team. A birth assistant a lot of times helps out the midwife. So they're not really a doula. It's kind of a transition between a doula and a midwife, but they really do help out the midwife. They're the midwife's assistant. So they may be at the home birth or the birthing center. And so the home birth is best suited for low risk pregnancies as well, where the birther prefers minimal intervention. So again, great for low risk pregnancies. And having a baby at home is also good for families with multiple children. So, usually if you're in the hospital or birth center, you may not want to bring the kids if you have small kids, but when you're home, they're in a comfortable setting. They can be in their rooms. They can participate with the birth process. So we all know being at home, you just love being at home sometimes, especially the older you get. Being at home, that's your sanctuary. You don't want to be outside. So being at home, getting the environment exactly how you want to with no restrictions. If you want that, this will be your best bet. And then also cultural considerations are important when you're finding the best birth setting. Consider settings that respect and integrate your cultural practices and preferences, such as the availability of culturally competent staff and birthing practices. So when it comes to choosing your birth setting, it is really important to check with either that hospital or birth center to see if they have tours. More than likely, they will have a tour that you can sign up for. And when you're on that tour, ask as many questions as possible, because this is your birth and you want to be educated on where you will be giving birth and if it is the best fit for you. When it comes to your culture should be respected. So you want to make sure that this setting is integrating your cultural practices. Do your research on the setting. There are plenty of resources out there. As doulas, we provide those resources if you need it, childbirth educators as well. There's also groups on Facebook. If you're on social media, there are a lot of pregnancy groups or birthing groups in your area that you can join on Facebook and ask those questions. I'm sure there are other mothers on there who may have had a birth at a certain hospital or birth center, so you can get that information about that from Facebook groups and different resources out there. Any questions about the birth setting before I move on to the last slide? Okay, finally, we have the impact of your birth team and setting. So collaboration and communication. A well-coordinated team ensures everyone is on the same page, reducing stress and supporting your birth preferences. I've been in healthcare for over 15 years. And so I've learned how important communicating is in the health setting. And so, and when I say communicating, also documenting. We have something called an electronic health record where we can document anything. You want to make sure that your birth team is talking to one another. It is so doctor, or excuse me, their nurse, and their doctor knows nothing, or they're talking to their doctor and their nurse knows nothing, and you have to, explain yourself again. And it can, especially if you're in labor, it can be frustrating. So you want to make sure that you have a team that are talking to one another so you don't have to keep explaining yourself. Cultural sensitivity. as I mentioned earlier, culturally competent care can improve your comfort and your trust, ensuring your traditions and preferences are respected. It is very important, especially in this time and age. We want to make sure that our culture is respected. And so again, that's when the research comes in, learning about your birth team and your setting, making sure they respect your culture. Definitely speak up for yourself. Okay, if something it doesn't feel right, or you feel that this is not a part of your culture, say something. Say something and say, I don't like this, or this is not, a part of my culture. Your birth team should be able to respect that, especially in this day and age. Interventions and autonomy. So the setting and team influence the likelihood and type of interventions used, whether it's an epidural or a C-section. Choose a team that support your desired level of autonomy. So that's why a doula is important, to help advocate for yourself. I personally believe there are times where interventions are not needed, but they are used. And so that's when research and doing what you're doing now, coming to a childbirth education class, is very important. You need to speak up and say, no, I don't want this, or I don't think this is best for me. This is not a part of my birth plan. Especially if you're not high risk, you don't have to do these things that maybe the doctor is suggesting. These are all suggestions that the doctor may do, unless the doctor comes in and says, hey, your baby is, at risk. We need to go in and do a C-section. It's important. It's important to save the life of you and your baby. That's when you may need to listen. But if the doctor is coming in just throwing things at you, hey, we're going to put you on this medication, hey, we're going to do this, hey, we're going to do that, and you're not sure about it, if it's not going to cause any harm to you or your baby, you have the right to say no. Emotional support. The presence of a supportive doula, midwife, or other trusted individuals can enhance your emotional well-being, reducing fear and increasing your sense of control. So it is important to check with the hospital or birthing center about how many people you can have in the room. I know with COVID, things have changed. Some hospitals still have certain restrictions. So you really want to check who can be in that birth room with you, because having that support is so important. You need that. We all need that as birthing people. So make sure you check to see who can be in that room with you. And then outcome and satisfaction. A well-matched team and setting contribute to positive birth outcomes and a satisfying birth experience, making it a moment of empowerment and joy. And so giving birth, we call it labor because it is an event where you are laboring. It's hard work. And so anytime you're doing any kind of hard work, whether it's at work or, if you already have children, that's hard work. You're always going to need a village. You're always going to need support. We are human. We can't do certain things by ourselves. The more support you have, the better outcomes. And so that's why I say your birthing team is super, super important. Your setting is super, super important. Also, if you identify as a Black or brown mom or birthing individual, is super important. With the Black maternal and infant mortality rate being very high, it is crucial that we really focus on who is best for us and who is going to protect us. If you've heard of, I think it's the Earth app, IRTH, you can go on there and see reviews from hospitals and birthing teams. That's super important because they're giving you the nitty gritty, like the actual reviews of their birthing experience in your area. So you'll be able to see all the true stats And I think what Earth does is takes that information to the hospitals and the birthing centers and confronts them with it if it's any negative reviews. So it's important to really see what your community is talking about when it comes to your setting and your birth team, so that you can make the best informed decisions. And then also Healthy Mother and Healthy Babies of Georgia, they have the resources as well. They are very familiar with the hospitals and the birthing teams in the community. So if you have any questions about that, definitely reach out, because they'll be able to help you and help you understand what may be best for your birthing experience. I think that is all from my section. Does anyone have any questions about what I went through? If not, I will stop sharing.
Thank you, Kia. We are going to take a mini break right now, actually. A 15-minute break for everyone to go to the bathroom, get a snack, recollect. So we will be back. It's 11:40. It's 11:38, but let's just say it's 11:40. So at 11:55, we will start back up, and then finish out the rest of the presentation. And at that time, Shia, you will be next. See. All right, everyone. We're coming back in. Coming back in. Next part will be Shaya's section. Kia or Monica, if you're back at the computer, can you check my message in the chat, please?
What do you need, Mimi?
You could do it for me. I didn't want to have you do it again, but I was gonna have one of them share the screen.
Oh,
to do
well,
the
yeah, because
slides
I'm
for
right after Shia, so whoever shares can kind of keep going.
Oh, wait, say it again.
I said, oh yeah, because I'm right after Shia, so whoever shares could kind of like just keep going for me.
Yeah, that's why I wasn't gonna have you. But my thing actually says it's Shia, then Makisha, then you. Is it the
Oh, okay.
Yeah, but that's why I
Wait, no,
wasn't.
I'm actually right after Shia on these new slides, I think.
Oh, okay. So it should be Shia, then you, then Makisha. Let me double check.
I would have to go. Yeah. I think maybe not.
Let's see. Next is supposed to be when to see your doctor and inductions. Okay, when to see your doctor.
Oh no, you're right. I'm last.
Inductions.
I'm still last on there. Okay.
Okay. Well, yeah, I didn't want to have you do it again, but I don't think Kia or Monica is back. I was trying to give them a few more minutes, but okay. So Holly, if you could do it for Shia and Makisha, then I can have someone else do it for you if you don't mind.
Okay, do you need to add me as co?
Yes. Oh, yeah, sorry. Let me do that again. You should be able to do it now. Let me know if it works. Perfect. And we will begin with Shia at when to see your doctor. And Shia, whenever you're ready, you can go ahead and get started.
Okay, perfect. Greetings, everyone. I hope the morning was good and very informative. I know a lot of great information has been shared. So I'm going to be talking to you all about when to see your doctor and some of the
real
key.
Quick, Shia. Sorry. Holly, go back like 2 slides, I think. One more. Yeah. Oh, another one. Sorry. Oh, another one.
This is
I think
good.
she has. Oh, here. Oh, well, there you
Want me
go.
to go to the next one?
She can start at the orange one. Sorry, Holly.
Thank you all. Okay, so I'm going to get into when, like routine visits and what to expect during your routine visits. But before then, I'm just going to tap in on the key signs and symptoms to watch out for during your pregnancy. So I'll preface this by saying, it's really important that we listen to our bodies and understand when something feels personally off or abnormal for you in the journey. So we talked earlier about your birth team. And I always say when something seems to have gone awry, your first line of defense is always your doula. And in the cases where there's an extreme case or you don't have a doula, you're experiencing any of these things, then it is important to go see your doctor or maybe do an emergency visit with labor and delivery triage. So some of these things are unusual pain or cramping. So during pregnancy, I know a couple mamas in here are doing November. So at this point in your journey, you've experienced some sort of discomfort, right? Your body's changing, your body's growing a baby. We talked about round ligament pain. So there's going to be some discomfort that you experience. But in the cases where there's sharp or severe pain, particularly in your lower abdomen, that's when you want to definitely go in and get checked out because it could be a sign of something more serious like an ectopic pregnancy or even preterm labor. So Braxton Hicks came up, and Braxton Hicks are false labor contractions. They're sporadic. They might feel like mild menstrual cramps. And those types of cramps and discomforts usually wouldn't result in a doctor's visit. So for example, if one of my birthing people reached out and they were experiencing Braxton Hicks, we might talk about hydration. I might have them talk to their provider about incorporating magnesium into their diet, or if there's no blood sugar issues, up in their intake of bananas or other potassium-rich foods. But if the pain, like I mentioned, is something that is more severe, something that they're not able to understand or even be with, at that point, we would recommend going in to see your doctor. Another thing is if you're experiencing vaginal bleeding or any fluid leaking. So any form of bleeding, especially in the second or third trimester, you definitely want to immediately report it to your provider. Now there are some, cases where birthers have placenta previa, which is when your placenta is attached to your lower uterus and it's partially covering your cervix. If this is a case for you in your second, third trimester, you probably already know you have placenta previa. It might have come up during an ultrasound, and you probably were warned that you would experience occasional bleeding throughout your pregnancy. In those cases, you already know that that's the case, and so you just monitor it. And if you bleed more than expected, then of course you want to, check in with your doctor. But if you don't have any, you hadn't been diagnosed with placenta previa, you shouldn't be bleeding. And so if you notice any vaginal bleeding, you definitely want to report that. And it's the same with fluid leakage. So if you're experiencing fluid leakage, and this is deeper than just, discharge, because you'll experience all sorts of discharge throughout the process. But if you find fluid leaking, you want to go see your doctor, as it could indicate premature rupture of membranes, and that is going to require prompt medical attention. Another thing is severe headaches, vision changes, or swelling. So just 2 weeks ago, actually, a mom reached out to me wondering if she should go in to her doctor because she was having this constant headache that wouldn't let up. She didn't want to go in because she went in maybe like at 27 weeks because she was having discomfort, and she felt that she kind of got brushed off as if, you're pregnant, of course you'll feel discomfort. But I encouraged her to go in because I wasn't comfortable with the severity of her headache. It had gotten to a state where she was very sensitive to light and was feeling nauseous. So she ended up going in to get her blood pressure checked, and she was admitted to the hospital. because her blood pressure had reached a level that was problematic, right? So anytime you're experiencing this, it could be a sign of preeclampsia. And the moment that like you're noticing the swelling, the headaches, the vision changes, you definitely want to go in. It's better to catch it as soon as possible and get the necessary support so that you wouldn't have, you know, any issues. As you all may know, preeclampsia is something that is, you know, rocking the birth world in so many ways, especially for mothers and women of color. And so it's a dangerous condition for both mother and baby if it isn't treated. So you just want to make sure you're monitoring your blood pressure. If you have a way to monitor your blood pressure at home, that's always great. That way, if you're feeling like, oh, you know, I have a headache, you can check your pressure right, you know, on the site. And if your pressure is fine, then maybe your headache could be a result of lack of nutrients or because of dehydration. But if you're not able to check your pressure at home and you're experiencing headache, swelling, and discomfort, you definitely want to go in and get checked and just make sure that your pressure is good and that you aren't experiencing any signs of preeclampsia. And then reduced fetal movement. So by your third trimester, in between your second and third trimester, you may begin to count fetal kicks, fetal monitoring. And this is you know, laying down, usually in the evening or at a time where your baby's active, and counting your fetal kicks. This is important because it gives you an idea of, you know, your baby's natural movement. You know, babies have different types of movements at different, you know, parts of the day. So there are times where your baby's super active, and there may be other times where your baby's not as active. But if there are moments that you're experiencing that you have reduced fetal movement, one of the things that you can do at home is take a minute to sit and count your fetal kicks. And within an hour, you would ideally want to have 10 movements. While any movement is good, that's just a typical number that, you know, your doctors and professionals will be looking for. If you know, like, oh, my baby's always active and I've been noticing like a lack of activity, or you do fetal monitoring and you notice that you don't have movement, then you definitely want to go in and just get checked. You know, we birth, labor, delivery, mother and baby are always on the brink in between these realms of life and death. So you just always want to double check when something personally, you know, feels off for you. And there could be, you know, if there's lack of fetal movement, excuse me, there could be issues with the cord. You know, there's been time where a cord is wrapped, or there's something that's happening that is affecting the baby's ability to function, to move properly. So always better safe than sorry. Just go in to get an evaluation and ensure that like everything is fine. The hospitals have these machines and, you know, high tech equipment for that reason, so that we're able to get an idea of what's happening inside. And anytime baby's under distress, we want to get them attention and mom attention as soon as possible. So lastly, if there's persistent nausea and vomiting, so morning sickness is a thing quite often that first trimester. A lot of birthers deal with morning sickness. You know, it's common. However, like excessive vomiting can lead to dehydration, which can cause weight loss and many other harmful things to mom and baby. So if the nausea is persistent, the vomiting is persistent, you definitely want to check in with your doctor, check in with your birth team, and see if there's any like special treatment that can ensure that you and baby are receiving adequate nutrition and definitely adequate hydration. So yeah, those are like some of the big signs that you want to pay attention to. And if you're experiencing any of them, you definitely don't want to hesitate to go in and see your doctor, contact your doula, and just get support on those areas. So now I'm going to move on to the next slide. And this is more about understanding your routine prenatal checkups. So are the slides still up? I can't see. They are.
Are you trying to see the screen that we have, Shia?
Yeah, I just wanted to make sure you all can still see it because it went away on my end.
Oh, we can see the screen. Holly's sharing it, so we can see it. It probably just going away on your end because you're talking. So as the speaker,
Okay,
you may not be able to see it.
okay, perfect. Thank you. Okay, so understanding your routine prenatal checkups. So during your first trimester, that is your week 1 through 12, always a very exciting time for families. This is when you first find out, and whatever way you find out, whether it's a missed period or you used some at-home form of pregnancy testing, but you find out that you're pregnant and you go in for your initial visit with your doctor. Sometimes this initial visit is meant to confirm the pregnancy, where you'll do like a urine test or a blood test. And then it also includes a comprehensive health assessment. So the blood test that you receive during those initial visits can, share if there's any sort of abnormalities or anything that needs to be monitored within baby or within mom. And then you'll also learn of any like chronic conditions, medications, and lifestyle factors that could affect your pregnancy. And then once you move on into your second trimester, and that's your weeks 13 to 26, usually this is around the time that most families start to work with their doula, and you start to have more regular visits with your provider, whether you're going to be going to see your OBGYN or you're choosing to maybe do a home birth with a midwife. You'll begin to have regular visits probably every 4 weeks. And these visits are meant to monitor your baby's growth and development. So you can expect different screenings for gestational diabetes, for anemia. You'll be getting the baby's anatomy scan to check for any, any growth or development things that may be worth noting or worth paying attention to in the baby. And, it's also an opportunity during these visits, if there's anything personally coming up, like some of the things that I mentioned about, fetal movement or headaches and all those things. If anything is coming up newly for you in the second trimester that you aren't used to or a cause for concern, using your regular visits to address these are always helpful. Your doctors may at that time want to run additional tests or anything like that, depending on what you share. And then once you get to your third trimester, that final stretch, your weeks 27 to 40, your visits become more frequent. And so they increase to about every 2 weeks, and sometimes weekly visits as well as you get closer. And this is an opportunity to monitor you and your baby's health as you are approaching delivery. For any births that are considered high risk, sometimes you are doing weekly visits. You might have a specialist that you're seeing in addition to, the visits with your OB or with your midwife. And so calendars and like time frame of visits kind of get intense during this period. And we're also, at this point, you're probably working with your doula or your birth team on your birth plan, your birth preferences. At this point, you already know if you're choosing to birth in a hospital or at home or in a birth center. And so you're working through, what your birth is going to look like, what you envision, what you need to pack in your birth bag if you are choosing to birth outside of the home. You're understanding more deeply the labor signs. So I talked earlier about Braxton Hicks, but you're starting to understand like, oh, if you actually do begin to experience discharge or bleeding at this point in your pregnancy, what it could mean as far as labor and delivery is concerned. And so these are the things that will come up. This is also a brilliant time to bring your birthing team together. So if you are, you have been working with a doula, and then you have your support person, whether it's the child's father or a mother or a sister that's going to be there, That third trimester is a really good time to bring everyone together with your OBGYN or your midwife to discuss the plans and the preferences for preparing for delivery. And, you know, during all of your visits too, with your providers, with your doula team, it's just important to make sure that you're communicating, you know, your own practices and cultural beliefs, as we all have different ways and methods, either within our family, within our bloodline, that we utilize in the birthing process. So it's really important that, you know, you're being heard and your preferences are being heard. So, you know, during these visits, especially once you're in that third trimester, you want to talk through your preferences around pain management. So if you're choosing to opt out of interventions, let's say, you know, during these visits is when you discuss that with your medical team, you discuss that with your birthing team, so that everyone knows the rituals that you are putting in place and the preferences that you have around your birth. It's also good to just kind of look at the big picture. So when we talk about birth plans and birth preferences, that's what they are, right? They're preferences for, if everything goes well, you know, this is how I want my birth to be, this is what I want my birth to look like. And then there are, you know, extreme cases where something may happen, baby's in distress, or a labor is longer and more intense than expected, and mom is tired and wants to explore, you know, options for intervention. So all this stuff can and should be talked about between that second and third trimester, just so that the birthing team is all on the same page and is able to support throughout the process and are able to pivot, you know, if something was to come up, because most of these things were, you know, talked about during the routine prenatal checkups. So we could go to the next slide. And this is knowing when to seek medical attention for you and your baby. And this could be during pregnancy or after pregnancy, but some of those things is if you have a fall or trauma, so any significant injury, you know, you fall, you know, downstairs, you trip and fall while you're walking, you're in a car accident, something falls on you, you know, even you hit your head, you're just doing something active, and there's any sort of trauma that experienced, you definitely want to seek medical attention and just ensure that the baby is unharmed. You also want to look out for signs of preterm labor. So 37 weeks is, you know, you've reached full term. So anytime before 37 weeks, if you're experiencing regular contractions, if you're experiencing pelvic pressure, any type of like lower back pain, it could indicate preterm labor, which requires prompt intervention. And so if you're noticing that like you're having consistent contractions or you're feeling a sort of pressure that you haven't felt before, you want to be in contact with your doula, with your birth team, and get recommendations. And then you may just want to go in and get checked to ensure that you aren't experiencing preterm. And the same with the like fluid leakage that we spoke about. If any of these things are happening prior to you being full term, you just want to get it double checked, get it checked out. And then postpartum, after delivery, there are, you know, a plethora of reasons that you might want to go in to seek medical attention if you notice something that happens abnormally. If you are, you know, back at home and you're noticing that you're experiencing heavy bleeding, abnormal bleeding. Again, if you're experiencing severe headaches or any types of swelling or chest pain, all of this could be signs of infection. It could be, you know, signs of clotting and things like that. So it's such a sensitive time. And I know, you know, some of us like culturally are so trained to thug it out and just, you know, push through. But during the time of like pregnancy and delivery and after delivery, everything is so sensitive, everything matters. So if there's something that's happening that feels out of the ordinary for you, especially those key warnings of like headaches or vision changes or swelling, you always want to go in, you want to seek attention and just count and rule out any sort of issue that may not be obvious to the eye. Another reason to seek medical attention is mental health concerns. So most likely if, excuse me, you brought on a doula, your doula will be supporting you postnatally as well. And so you would have at least one visit with your doula after you have your baby, but probably depending on, you know, the packages that you all worked out, you'll probably have the ability to have several visits. But you just want to notice if there's any mental health concerns or emotional changes are going to happen, like hormones are all over the place. Lifestyle is changing most of the time. You know, you bring home your new baby, sleep shifts, sleep schedule shift. There's excitement, and then there's like anxiety, and there's all of these different emotions that come with the territory of birth and, you know, readjusting to your new normal. And so some emotional fluctuations are normal, but if there's persistent feelings of sadness, if, you know, you are feeling unable to connect with your baby, or even just like extremely anxious in a way that you are even unable to connect with yourself, and it begins to feel sort of out of body for you, if you have overwhelming fear, all of these things are worth a conversation with your birth team. They're worth a conversation with a mental health professional, because, you know, sometimes the switch in hormones could completely affect your mental health to the point where you begin to experience, you know, extreme anxiety or conditions that may be debilitating for you to care for yourself and your baby. And so while it's such a sensitive time, you do want to note, you know, and find safe spaces where you can be honest about the way that you feel so that you can get support. And sometimes, you know, support may look like extra hands helping out. Sometimes support may look like a shift in, you know, your nutritional supplements and the foods that you're eating to help you. And sometimes you do need to see a professional. And sometimes you may need to explore medical intervention to help you get that balanced. I know that there are a lot of birthing people that consider doing placenta encapsulation because there's research on both sides. And one of the sides of that research is that actually, you know, having the intake of your placenta can help to balance out emotions, help with like the production of your milk, can help to like just get you into a good place if you're experiencing mood disorders. So this is something that can be discussed again with your doula, and just depending on your own culture and your own values, just understanding too what it is that the other women in your family has done to help balance themselves postnatally. And having, you know, a part of that birth planning and birth preferences is thinking about postnatally what the support will look like, because extra support is in so many ways a balm for families postnatally. So understanding like meal preparation, like who's going to be responsible. Is there going to be, you know, a meal train coming in from friends and family? Are you going to have a parent or, you know, a friend or postpartum doula in the home to help prepare meals and make sure that, you know, you're getting the correct nutrition, and to ensure that you're able to have a moment to yourself, even to like take a long shower while baby's being cared for. So it's just important to think through what that support is going to look like postnatally, and ensuring that like your family, your community have their marching orders, right? So that they're able to support you and support the family accordingly. So yeah, okay, I'm gonna go on to talk about inductions and reasons why labor might need to be induced. And so when we talk about inductions, usually a cause for inducing labor, well, it should be a medical concern, and the labor may be induced if there are medical concerns for the mother and or for the baby. So some of these like medical indications of induction is a post-term pregnancy. So if you are pregnant beyond 42 weeks, it can increase the risk of complications. Not only is the baby growing, so this is something that comes up really often that I'll just point out, like baby size is not a cause for induction. It's not a medical reason for induction. However, the more obviously that the baby's still in utero and growing, it could pose complications, right? So anytime you are going beyond 42, and quite often if you're going to do, if you're choosing to like birth in a hospital, they might start these conversations with you around 38 or 40 weeks. But definitely once you get past 42, you may become, it may become necessary for a medical induction. If there are signs of preeclampsia or hypotension, so if your blood pressure is high and if your blood pressure is spiking consistently, that poses a serious risk to mother and baby. And in those cases, your medical team will likely make recommendations for medical induction. Uncontrolled gestational diabetes could also be something that necessitates induction, and this is to avoid complications, premature rupture of membranes. So if your water breaks, but labor doesn't start naturally within a certain time, most of the times, like your midwives and your doctor will give you a window of time after your membrane ruptures before they need to induce. And that can vary between like 24 and 48 hours. But usually post that time, the conversation of induction comes up to reduce the risk of infection. And then if there's fetal growth restriction, so if the baby isn't growing as expected, this will be, monitored during your routine visits. And if there's been, it's been being noticed in ultrasounds that the baby isn't growing as expected, then induction might become recommended. So it's also worth noting that some women elect to have inductions for non-medical reasons. So, sometimes families are planning around personal schedules. Sometimes families just want to have a Leo instead of a Virgo. And so they decide to elect for an induction. And sometimes, again, when we talk about cultural considerations, I recently supported a family who, this young lady, for their family, their cultural tradition is that they schedule inductions. Her mom, her sisters, her aunts, they've all had scheduled cesarean sections. And so for her, it wasn't a question of, or even like an interest in veering away from that. So this particular family, they were very sure that they were going to do an elective induction, and that is what they did. So it's also just, understanding that people have different beliefs, different practices, and different reasons for induction. And so those are some of the reasons why, it may come up within your medical team for an induction. And then I'll talk a little bit on the next slide about the methods of induction and what to expect. And I guess it's also worth noting there are some times, right, where the birthing family has no interest in intervention or inductions, but it's being recommended. And in those cases, it is also great to just work with your doula because there are things that can be done at home to help with the process of induction, even certain types of exercises and walking, and just natural methods to help your body prepare itself for labor and delivery, and sometimes even to help to speed up the process. I know that there's so many that, like some examples like red raspberry leaf tea, it's not going to speed up necessarily your delivery, but it is going to tone the uterus. and toning the uterus is helpful, you know, during labor. It's definitely helpful postpartum to avoid any hemorrhaging. And so that's something that, you know, your doula or your birth team might recommend to you. Dates are another thing, like having, you know, your 6 to 10 dates a day to help with your process of at home and natural induction. And then there's different types of foods and things that you can eat. So it's always important, if induction is something that you're trying to avoid, to work with your birthing team to see, like, what are the things that you can be doing at home once you reach full term to help prepare your body, your uterus, your cervix for bringing baby. But if you do go the induction route, some of the medications that are used and you can expect to be used during that is prostaglandins, excuse me, and those are used to soften the cervix and help it to dilate. And then the other thing that's often used is Pitocin, which is a form of faux oxytocin, I'll say. So it's a synthetic hormone that is used to stimulate contractions. So with the prostaglandins, there's a few different ways that this is done, depending too if you're doing it at home or even like in a birthing center. So one thing is a Foley or catheter or a balloon. So it's a small balloon that's inserted into the cervix to help it open. Oftentimes, if you're going to go in for induction, you'll get admitted into the hospital and they'll enter this balloon and let the balloon sit for somewhere around 12 hours. And then they'll check again to see if your cervix have begun to dilate or ripen. Something that can be done and is often done by midwives and medical professionals even before the insertion of a balloon is membrane stripping. And this is a manual procedure when your healthcare provider separates the amniotic sac from the wall in the uterus, and this is meant to encourage labor. There are some midwives and occasional, depending on where you're located, some birthing centers that incorporate a DilaPen, which is these rods that are used, and they're meant to soften and open the cervix. I think one of the good things about the DilaPen is you don't have to be admitted in order to do this. So you'll go in and you'll have the rods inserted, and then you can go about your your daily routine, go back home, sleep, do all the things that you need to do, and then they're usually removed within 24 hours. And at that point there should be some sort of opening of your cervix during that time. And it's usually recommended, you know, if you're going into birth, that once the DilaPen is removed, then your induction process will start, so you'll remain in the hospital at that point or at the birthing center. And so that's also an option. And so other ways for induction is also breaking the water. So this is when, like an intervention process, when a small hook is used to break the amniotic sac, which can help start contractions. So when you think about like the order of events, I guess, to just put it in a way that kind of is a little bit linear, if you are going in for an induction, and let's just say, you've reached 42 weeks and the recommendation is for you to get induced, the first step would either be something to like soften your cervix. So if the DilaPen was something that was available, that may be the way to go. Or if the balloon is the option, you do one of these things first, and then there'll be, where you would be for about 12 to 24 hours, either at home or in a hospital. And that will sort of be like your first level of induction. And then after that, you'll be checked, your cervix will be checked to see where you are. And depending on where you are at that point, you might just allow things to happen as they do. Labor can be a really slow process for some, it could be a really fast process for others. So, at that point, maybe you're dilated 2 or 3 centimeters. And then some, medical teams would just let you be and see how that goes for a while. And then if if the progress is still pretty slow, they may make a recommendation to bring another form of intervention, which might be Pitocin. And when they, administer the Pitocin, and this can only happen in a hospital, you wouldn't get like Pitocin administered at a birthing center or at home. But if you're in a hospital and you get Pitocin, those are going to most likely increase contractions. It could cause, contractions to be really sporadic, and sometimes it can cause fluctuations, right, with the heart rate of the baby. So you'll definitely be being monitored during that time. And we talked about consent earlier. So with every intervention, like you're giving consent for like every intervention as it occurs. And oftentimes, like one intervention may come with another intervention, So as an example, like you may start off with Pitocin, and because the contractions are, becoming really erratic, and, they may be happening at a level that is really intense, it may warrant the use of something to subset the pain. So that's just always something to think about as you're making choices on what interventions you want to use, and what interventions will be the best to bring forth a healthy baby, which is ultimately the goal. And then when it comes to breaking of the water, a lot of times that might happen when you're more dilated, but maybe the baby is still up a little higher than necessary. Your medical professional may make the recommendation of breaking the water so that the contractions, the baby's head is more in alignment with the cervix, and the contractions are happening in such a way that it's helping to open the cervix. So just understanding all the options are really important. Also, always understanding what is most important for your own preferences and your own background, and what is most utilized in your own like cultural and ritual beliefs is important to have. And again, a lot of this stuff can be ironed out in your birth preferences and then utilized in accordance as labor and delivery is happening and as different things are coming up. But in each moment, there's always a need for consent, and families are always able to opt in or out of any of the interventions that are being recommended. So the next slide, we'll talk about some of the risk and benefits associated with inductions. So one of the major benefits is obviously the prevention of complications. There are times when, baby is in distress. There are times when the birthing person is in distress, and induction is what is used to prevent risk associated with a prolonged pregnancy, prolonged labor, or even different certain medical conditions. I talked a little bit earlier about placenta previa, and there's some times when, yes, that placenta is blocking the cervix and there isn't the space or opportunity for baby to come through the cervix. And so sometimes some sort of induction or, prevention is necessary. So we give thanks for the opportunity to have interventions where necessary, and we use our team, our resources to manage when and how they're used. The other benefit of induction is a controlled environment. So I had mentioned the story earlier of a family who it's like culturally what they do is schedule inductions. For them, it's been passed down that it's just more predictable to schedule an induction rather than to spontaneously go into labor and lose the control of the environment or what might happen. And so sometimes in certain traditions and certain cultures and certain preferences, it's beneficial to be able to, it's a benefit to be able to control the environment and control the timing in which your baby is born. Some of the risks that are associated with induction is increased intervention. And I kind of touched on this a little bit. So induced labor may lead to more medical interventions. So the example that I used about receiving Pitocin, and if the Pitocin causes baby's heart rate to increase and or decrease, and things start to go awry, that may result in a cesarean section, right? Because now it is indeed a medical emergency. Or, you know, if the contractions become too intense and it is, you know, wearing the birthing person out, you need energy, right? You need energy to be able to push, you need energy to make your way through. And sometimes the only relief that becomes available is an epidural. And so it's just knowing that it could cascade into other interventions if you choose to, or if it's recommended that you have an induction. A risk can sometimes be longer labor. It could be in a more intense labor process when the body isn't able to just do, you know, what it does and move at its own pace. Sometimes when we're trying to, or when the recommendation is to rush or speed up the process, it could also intensify the process and it can lead to fetal distress. And so that is a small risk that is always associated with induction, is that the contractions are too strong and it's leading to stress for the baby. Or as I mentioned, just completely wearing out the birthing person. So those are some things to pay attention to. Actually, that wraps up my portion. If there are any questions about induction, about, you know, reasons why you should visit your providers, you can definitely write them in the chat or let me know. But I'm going to pass the mic over to Makisha to talk to y'all about breastfeeding. Thank you.
If you guys do have any questions, please feel free to put in the chat. And Makisha, whenever you're ready, you can get started.
Okay, I'm just gonna see nobody has anything in the chat. Okay, so I am going to discuss the benefits of breastfeeding as it relates to the mother as well as the baby. So the first thing that we are going to discuss is the optimum nutrition as it relates to the baby. So breast milk is also often referred to as liquid gold because the milk comes in 3 different phases. So the first phase of the milk is colostrum, which is like immediately after birth, where the colostrum is yellow or gold in color. So it's referred to as liquid gold. It's also referred to as liquid gold because of the high content of nutrients and proteins and antibodies that are present. Now, the body is so amazing and intricately designed that as great as the breast milk is in content as far as health and nutrition to the baby, in full-term births, when a woman gives birth prematurely, all of those nutrients and contents are more concentrated. So the level of, well, we'll discuss this and then I'll tell you how they vary. So the breast milk comes in, it's got proteins in it, it has fats in it, and the fats that are in the breast milk for premature babies is actually of a different substance than that of full-term babies to make it easier for the infant to digest. The antibodies are passed from the mother to the baby. So if the mother is sick, the antibodies that her body naturally produces to help her fight off an infection or whatever the sickness is will be transmitted to the baby to prevent the baby from contracting them at all. It also provides immune support. So we've discussed that, the different vitamins that are present in breast milk. So, and this goes back to what Monica was discussing and that everybody pretty much touched on as far as healthy eating. So we also have to be mindful of the fact that everything that we eat is transmitted to baby. So if you have a healthy diet, then just naturally by the things that you intake and you ingest, then that will be transferred to the baby. However, if not, just for different reasons, be it morning sickness or even life, like the reality of it is life is very busy, which is why breastfeeding is not like prior to the 60s or the 40s, breastfeeding was the primary source of feeding babies. But because we have work and we have other children and we don't have access to wet nurses or someone who has the time to nurse our babies, hence the introduction of formula, we also don't always have time to eat healthy. So keeping in mind that so that your baby does get those nutrients from the breast milk, we want to ingest supplements if necessary. So vitamins, and you can speak with your doctor in regards to that. And then the long-term health benefits of nursing or breastfeeding the baby, it actually will prevent certain illnesses such as diabetes, cancers, and things of that nature just by you nursing your baby. And the CDC does recommend that solely as the sole method of feeding, if possible, up to 6 months. Now, because we are discussing this and the benefits of this, by all means, as a mother, we encourage you to make the decision as to what works for you. And so we'll give you the benefits of this, but do not feel like less than, because we'll discuss later on, there are certain things or certain situations where it's not just a life issue. It's not just a time issue, that some women are just overproducers and some women just produce less amounts of milk, which make breastfeeding challenging. And that's okay. Thankfully, now we do have donors who can, provide milk to mothers who are in those situations. And there are alternatives, for you. So now, as it relates to the mother and the physical benefits of breastfeeding, so there are multiple. One of which is it promotes better emotional health. It keeps the mom calm when you are nursing your baby. So that is one of the benefits of it. It reduces, it promotes bonding with the mother and the baby. So in that time, you get to develop a sense of closeness. The skin-to-skin contact is beneficial for baby as far as, developing and, to feel comfortable and secure, as well as for the mother. And then oxytocin is also released in that skin-to-skin contact with the mother and the baby, which is a hormone that promotes love and trust and attachment for both mom and baby. So there are multiple benefits for both the mother and baby, as well as the mom's emotional well-being. And let's see here if there's anything that Okay, so did anyone have any questions about this slide before we go on? Okay, next slide, please. So we do have tips and techniques for successful breastfeeding. So it is something that happens just naturally, and you'll see it especially in situations where there have not been as many medical interventions in regards to pain medications or cesarean sections, where you have a situation where mom has not been given any of those medications and baby is more alert during birth. You'll see it oftentimes in home births, that instantly when the baby is born and you place the baby on your chest, and the baby instantly starts rooting and looking to nurse. And so in situations where all goes well, and as we would all hope that it does, the baby latches on and the baby begins to nurse, and, colostrum, which is produced within the first up to 1 to 2 days after birth, the baby starts to feed. Now, so that is something that will happen after birth. And what you do want is to make sure that the baby's mouth is open wide and that the areola of the nipple is in baby's mouth. Some of you who may have nursed before, you know that if the baby is not properly latched, that is something that is very painful. And but it also does not allow the baby to get a good amount of milk. And so the latching is very important. Now, comfortable positioning. Of course, you have the position of, where mom is sitting upright, and then you're just cradling the baby in your arms. You also have the option to do what is referred to as a football hold, where you are holding the baby with the head in the palm of your hand, and then the legs and the rest of the body, kind of behind you, and then you're holding the baby this way. You also have the option to lay, and this again is just depending on what you're doing and what's more comfortable for you, to be in a laying position and then allow baby's head to be resting in the bend of your arm and to nurse in that position. And it's a matter of personal preference. And then we have here feeding cues. So there are various feeding cues. It's recommended that, especially when you're nursing, that you keep the baby in the room or close to you, so that you are able to pick up on these feeding cues. Some people opt to put their baby on a schedule where it's, I want to feed them every 2 hours. Some people opt to, feel like when they're hungry, they'll eat, they'll let me know. They're sleeping a lot, they'll wake up and let me know. But some of the feeding cues are crying. I know personally when my girls were nursing, when it was time for them to eat, if they were hungry and it got to that point, they would cry. It may have started off as a whimper, but when they would cry, I would begin to let down. And it's because it's like a natural, almost like a call and effect, with the mother and the baby. And then my milk would begin to let down. So those are some feeding cues. And then we have the breast care. So you do want to make sure that you are showering on a daily basis and keeping your body clean. You don't necessarily have to shower in between every feeding, but that is something that you do want to do as far as body and nipple care. We want to, hang on one second. Okay, so I'm sorry, I got caught up between the two sets of notes here. Letter. Okay, so also as far as the body care, the type of bra and clothing that you wear, you want to make that as comfortable and easily accessible for you as possible. So you want to wear, a top or a dress that, can easily be buttoned down so that you can gain access to the breast to offer to the baby. You also want to get a bra that will allow you to give easy access as well to your baby when feeding. You want to maintain like the nursing pads within your bra so that if you should get any leakage, then that is something the pads will catch that. And then there may be some soreness and, tenderness and sometimes even cracking just from, the baby, even if you do get a proper latching just from the baby just sucking, because the gums and, just the sucking on the nipples, which are very tender and sensitive, you may get some cracking and sometimes even bleeding, which can become painful. And at that point, you may want to utilize a lanolin or some type of cream. So if we could have the next slide, please. So common challenges as it relates to nursing. And so again, we have the issue of latching issues. So this is where you want to rely on your resources. I know that in an effort to become independent, years ago, it was common for, when midwives did all of the deliveries, and then you had a lot of things that we now know might be old wives' tales, but there's always that grandma or that aunt or the mom who comes around and says, this was helpful for me. You can do that. We also can rely, some people don't necessarily have a support system. And so different latching techniques can be given to you, but also reach out to a lactation consultant or a breastfeeding specialist that can help you and give you some tips and pointers on latching techniques. Now, also low milk supply. Again, as we spoke earlier about the importance of nutrition, breast milk has the vast majority of it in content is water. And so you do want to make sure that you as mom are staying hydrated so that you can produce enough milk for the baby. But this is something that's very important. It can be very frustrating. And I encourage any of you who may face the challenge of a low milk supply to not give up, on the idea of nursing, because not everybody is an overproducer. I do know that, with my first daughter, I produced a lot more milk than I was able to with my second daughter. And then I had a preemie who was in the NICU. So as long as I was there and able to eat and drink properly, I was mass producing milk. But when I came home to two small toddlers, my level of milk production decreased because I was not able to keep up with my, eating and drinking as much as I was when I did not have them to attend to. So there are various things that's something that could contribute to low milk supply, but you also have situations where it may be a medical issue. So such as, thyroid disease or things of that nature. So to just kind of stick with it and give yourself some time and some grace, try to figure out what the source of your low milk supply is, and then see if that's something that can be resolved. Again, we have the sore nipples, and we discussed earlier, the use of lanolin cream. Showers can also help with that. Warm compresses or cold compresses as far as like the sore nipples. And then as it relates to engorgement, which is where the breasts become just milk may back up for different reasons. The baby may not be nursing as often, or you may not be pumping as often, or you just may be overproducing, and sometimes it just happens. So again, you have standing in a warm shower can help with engorgement, and that will encourage letdown. Just holding, keeping compresses on the breast and things of that nature can help with that. So did anybody have any questions about the nursing or engorgement or any challenges or anything they would like to add? Okay, next slide, please. Now we are going to talk about the importance of partner support and involvement during the labor, pregnancy, and birthing experience, and even after. So next slide, please. So the partner support does play a very vital role in the birth experience. Again, we have just very unorthodox family situations and dynamics. Things happen. Some people are alone, so it may not have necessarily, be the father who is your support person, but I encourage you, if at all possible, to get the support of a partner, someone in the community, or, just whomever that may be for and to you, because the emotional and physical benefits of the presence of someone else is going to be very beneficial to you during the pregnancy, to keep down levels of stress, and just to put you in a comfortable place, as well as during the labor and delivery. Okay, so during pregnancy, we've discussed that. In labor, it improves the birth experience to have a partner, and the continuous presence of someone can lead to a more positive birth outcome. It will reduce the need for pain relief, and it can also help to reduce the need for an assisted birth or a cesarean. And so this may be a doula, this may be your actual partner, it may be a friend or a family member or someone that you know. It also promotes a sense of control, just to help you feel more in control, and to, know that you have someone there who is there supporting you, can then give you the strength that you may need to advocate for yourself. and it also alleviates feelings of loneliness. So, and this is during labor. And then postpartum, having support of a partner can help, be it that you have someone at home to help with household chores, help with caring for the children. I know in some cultures, they have something where they will have like members of the family and friends that will come, and then for 40 days they just do everything that the mother as well as the father need to maintain the household. So that's cooking, that's cleaning, that's laundry, that's caring for children, so that the mother can just have that one-on-one time with baby. I know not a lot of us have access to that now because a lot of people that we're connected to, do have their own lives. But if you can have a doula, or, just to have someone maybe to create a meal train, even if it's for just the first week postpartum, or, just something that at your baby shower, you just allow people to sign up that, they will bring meals over, or even if it's pre-made meals that you can pop in the oven. Another idea or something that you could think about is at your baby shower. A lot of times people bring things just for the baby. And of course, that's traditionally what it's for. But you also want to make sure that you are in tip-top condition so that you can be the best mom that you can be for baby and yourself and your family. Also ask for gift cards to restaurants, and just keeping in mind that you want healthy options for you to eat after, baby is had and at home. Next slide, please. All right, so this one is very, very important, the emotional support. And so with hormones already raging with the pregnancy, it's very important to be mindful of the fact that just life and pregnancy can put you in, it's going to make you more emotional in general. However, afterwards, just be mindful of, the fact that allow yourself to be expressive of what it is that's going on and what it is that you're feeling. Also, to ensure that if you do start to experience postpartum depression, that's something that you can be open about. But also, this is where the support of, your support person, the presence of your support person, I'm sorry, comes in handy, because they may recognize that you're not yourself before you do, because we have a tendency to feel like we need to be strong for, everyone, including ourselves, and we might not even necessarily recognize that something is going on. So this is a discussion that I encourage everyone to have now. I saw that some of you are giving birth in November. So to build a support team and have a support person that is there for you, that knows what you're like on a day-to-day basis and knows where you are and is understanding of the fact that, okay, she's going to be tired. Some days she may be a little bit irritable, but if I do notice that she's a little bit more down than normal, just be open to having someone who can pick up on and point out that, okay, this may be lasting a little bit longer, or this may be, beyond just you being tired. Because in the event that something happens emotionally in regards to, postpartum depression or something of that nature, then you do want to have that person there who can be an emotional support system for you. But also there are resources that you can reach out to should you start to deal with postpartum depression, which is something that is normal. As far as the partner is concerned, if they could be patient with you, because you're already not going to be patient with yourself at times. And so it's important that they're patient with you, but also you to be patient with them, because, we're learning each other. And then offer, consistent reassurance. Like in those moments, we wonder if we're being the best mom, if we're being the best wife, if we're being the best mother, not just to the new baby, but even to ourselves. So as a support person, it's important that they continue to offer consistent reassurance to the person or the mom that you're supporting. And then as far as practical support, this is something that we, discussed just a moment ago, help with daily tasks, the cooking and the cleaning and laundry and things of that nature, the preparing of the meals, and then helping to create a comfortable environment. And the next slide, please. So effective communication and teamwork strategy. So again, the time to have the open dialogue, I would start it now, because once you're in it, sometimes we have a tendency to be defensive. If someone is make sure that you have someone close to you that you know and love and trust, and that you can trust their opinion, so that when it's time to have that open dialogue, you trust that they may see something, and it's not always something negative. It might be that you're trying to do too much. It might not, be postpartum. It might be you're just overdoing it and not allowing yourself the time to rest that you need to, and allowing people to help you. So just be open to having a dialogue, and then come together and make a collaborative decision. A lot of times we have a tendency to be fixers and we want to do everything, but sometimes having a collaborative decision means relinquishing some of your, the responsibility to someone else, and allowing their decision might be, okay, let me help you do this. Be open to that. Be receptive of that if it's something that you have. And then respect cultural values. So again, we just discussed how, in some cultures they come in and, for 40 days, you got people just serving you and dad in the home so that you have to do nothing. In some cultures, they don't want anyone in or around them or their baby at all for, a certain period of time. So this is where it's very important to make sure that you are aware of the values of the person, who is having the baby, and that you're not offended by something. Like, you have to respect what it is that they desire. And then picking up on nonverbal cues. And so those are just the actions of, people around you. And then conflict resolution, just being understanding of the fact that, people are emotional, especially in this time, and that, just to set up now different ways of dealing with conflict that is going to cause the least amount of stress for mom. And next slide, please. All righty. Did anybody have any questions or comments?
Thank you.
You're welcome.
Holly, you can stop sharing your screen. Kia or Monica, are you guys able to share your screen for Holly?
I'm not able to share my screen. I'm sorry.
I can go ahead and do it.
Okay, thank you, Kia. You should still, let me make sure. Yeah, you still should have co-host privileges. Thank you. And for our
Thank you,
moms,
Kia.
this is our last instructor, so we're almost there.
All right, just 1 second, y'all. My name is Holly, by the way. All right, maternal mental health. Maternal mental health, it influences our well-being. It has a direct effect on mama, baby, and the entire family. Emotional changes are expected. A baby is a huge transition in life, whether it's an addition or if it's your first baby. It contains a lot of unknowns and hormonal changes. It is important to know what is considered normal and what is the cause for concern. It's also important to note that what people or what environment trigger you, and you can start creating boundaries for yourself. Next slide. Okay, importance of mental health during and after pregnancy. Actually, next slide. Yeah. Okay, so now we're going to go into recognizing what is a cause for concern, what is normal, and what is a cause for concern. So let's note that postpartum does not mean depression. Postpartum is the period after birth. Postpartum depression is a mood disorder. After birth, about 80% of moms experience mood swings or weepiness, or what we call baby blues. but it should resolve in about 2 to 3 weeks on its own. It does not require medical attention. It is a transition period and it is expected until families find their own flow. But if you are experiencing any of these in excess, and excess meaning constantly, every day, something that can't be erased, worrying, fear of what will happen to you or the baby, feelings of dread, sleep disruption, feelings of guilt, feelings of rage, racing thoughts, postpartum panic, postpartum OCD, recurring thoughts of harming yourself or your baby. You may have postpartum anxiety or depression or another mood disorder, and you should seek help. If partners notice a severe difference in their partners, because they will notice first, partners will notice first, doulas will notice as well. This is for partners and support people, try as best as you can to reach, to have grace with them and be patient with them, but also you can reach out to a support source as well. There are hotlines that you can call. There is a suicide hotline that you can call or text, which is 988. You can also speak to your provider. And there are therapists that specialize in perinatal health or pregnancy and postpartum who will meet with you virtually. Some other resources are Push Through Mom, which you can find on Facebook, Instagram, or by website. Healthy Mothers, Healthy Babies, Pickles, and Ice Cream Support Groups. If there's any other that y'all know, y'all can put it in the chat as far as resources. But those are the ones off the top of my head. Next slide, please. Yeah. All right, so now we're gonna talk about postpartum, which has been mentioned a lot. Right, the postpartum period or the 4th trimester is up to 40 days after birth. So this is probably the most important period. Is where you heal from your body, making the necessary adjustments involved in carrying the baby, and also providing you the strength of labor and birthing, or if you had a major surgery like a cesarean. So you are healing from all of these things during postpartum. You're also getting to know your baby and you're finding the flow with your partner and your family. Here are some discomforts to expect. Next slide. Thank you. So uterine involution, which is cramping, is your uterus shrinking back to its normal size. So after birth and you will cramp down and then your placenta will be birthed. And after the placenta is birthed, you will still cramp, especially while breastfeeding. The breastfeeding actually causes the uterus to contract because you're getting rid of all of the extra lochia or the bleeding or blood that was present while pregnant. So you can bleed or have the lochia for several days after birth. The blood should not fill an entire pad in an hour. You should not have clots the size of a golf ball. And you may have light bleeding or spotting for up to 6 weeks. So the whole 40 days postpartum period, you may bleed. Some people stop bleeding really early though, like after a week. And others, they bleed the whole time. It's just different for everybody. You may also experience soreness or muscle tightness when you do have a vaginal birth or when you have contractions period. Your whole body is literally working, all of your muscles, even your brain muscles are working. So you will experience some soreness after birth, breast tenderness, because your milk is coming in. You may be very fatigued or tired, especially if you have a really long labor. Your pelvic floor has to expand and it needs time to heal and regain its elasticity. So when a person is up moving a lot, carrying things heavier than their baby, or doing anything that requires weight, it puts a strain on the pelvic floor. And it can result in a weaker pelvic floor. So it's very important in postpartum to not carry anything heavier than your baby. Monica?
I just wanted to add two things.
Okay.
Because this is how my brain works in acronyms and little memory mnemonics.
Okay.
And that's the 555 in the immediate postpartum period. And if you can't remember anything else, remember 555.
Oh,
Five.
yes. I was going to touch on that in a little bit.
Oh, I'm
But you
so
can go
sorry.
ahead and say if you want to.
I am so sorry. Oh, and it's really because of lived experience. And it goes along with what you were saying with the postpartum bleeding. So if you're not gentle with yourself in the immediate postpartum, your bleeding could begin to wane off, and then you're up and doing basically too much in the immediate postpartum, and then your bleeding can come back, and that's with the flood. And that's an indication that you're moving your body along a little bit too quickly. My apologies for stepping over in your presentation territory.
It's okay. Thank you. Another thing is if you have a cesarean scar, aftercare of a cesarean birth incision is very simple. You keep it clean, you keep it dry. You can also bind the belly post-birth in case, in this case, is very helpful. It brings a sense of comfort and puts less strain on the incision site. If you do have a cesarean incision, it should be healed in 8 weeks. If you do have a scar from an episiotomy or cesarean or sutures in case you tear, none of these incisions should be bleeding, pussing or oozing discharge, or have a smell. The area should not be hot or have sharp pains. If you experience any of that, you need to contact your doctor because it could be infected. All right. So now I'm going to talk about some post-birth warning signs. It's literally an acronym for the word post-birth. So pain in chest, obstructed breathing, seizures, thoughts or feelings of hurting yourself or wanting to hurt your baby, bleeding, heavy bleeding. Some bleeding is normal, but if you're experiencing heavy bleeding, then that's something to look out for. Your incision not healing, redness or swelling, or warmth in your calf of your leg. It could be a blood clot, having a temperature of 100.4 or higher, followed by vaginal odor or discharge, which could also indicate infection, having headaches with vision changes. If you experience any of that, or if your partner sees any of those signs, then that is considered an emergency and you need to contact your provider or go to an emergency room. Okay, so next is the physical changes. Don't be in a rush to snap back or to be outside in a crowd. The body has expanded, so it will take a while to get back down to normal or close to it. Your boobs will get bigger because of milk, and it's very common for your hair to thin or break. But making sure you're getting your nutrients in and having a proper diet can help combat that. But all of those are normal changes. Emotional changes, your hormones are still regulating, they're still all over the place. Your emotions will run high. Make sure you have a healthy outlet to balance your emotions. But most of all, give yourself grace. And as me and my sisters like to say, surrender, just surrender to the process. It's just something you have to get through. It's something all moms have to go through, this transition phase. Especially since sleep will be a lot less since you do have the new addition. You just have to make sure you are taking care of yourself and having grace with yourself. Make sure you have people you can reach out to who you can be vulnerable with and honest with. So if you need to call and tell somebody like, I am just not, I am not feeling this, or I feel this way about this, someone who won't judge you, is really great to have those people. Some people don't have people that can really reach out to and talk to. So there are lots of groups that you can join and communities of new moms that you can join where y'all can share stories and experiences with. A lot of women struggle with losing themselves. It's important to focus on evolving into a mother and being present where you are. So there's no need to dwell on who you were or feel like you lost a part of yourself. You just evolved into a new person. And it's very important not to compare yourself or your experiences to anyone else. Connection to the baby. Some people feel they have an immediate connection to their baby. Others, it may take some time. Some feel they need time to learn and get to know their baby. Like, this is a new being. Who are you, baby? Show me and tell me who you are. Either way, they're new here, and all great things take time, and you will have plenty of bonding time. So create space to bond with your baby through feedings, singing, reading, and just observing them. If you feel your baby is hard to read, you can start making lists of times that they do significant things like eat, pee, poop, nap, just so you can give yourself like a general idea of how your days will flow. All right, next slide. All right, here's some general postpartum tips. And also for self-care and seeking support. It's all going to be together. Make a realistic schedule and plan to make sure it's successful. So postpartum is something you should be planning for probably when you're like 6 months. You need to be thinking about meals. Can you freeze meals? Can people bring them to you? Can you order meals? Can you create a meal train? Continue to take your prenatals and drink your womb teas. It's important to stay warm after birth. So the teas, eating soup or nutritious broths, keeping socks on your feet. Take vitamin C or intake citrus to prevent infection. Plan who can clean and organize things for you. If you have other children, who can pick up other children and make sure their schedule is still aligned. Remember to eat very close to your pregnancy diet. Overhydrate, especially if you're breastfeeding. You need to be hydrating, drinking water all day, water, tea, smoothies. Prioritize rest. So what Monica was mentioning was the general 5-5-5 rule, and then in some cultures they'll say 7-7-7. Some cultures 14, and then it just depends. Some people like to do extended postpartum, is what we call it. So the 5-5-5 rule is 5 days in your bed, 5 days around your bed, and 5 days close to your bed or near the bed. So no steps immediately postpartum. I wouldn't be going up and down steps because your pelvic floor is very sensitive, especially if you have a cesarean or have any type of incision. Those things can come out and cause you to bleed. Let's see. Do not lift anything heavier than your baby. You just really need to give your body time to recover. Your body is not going to be the same. It's not going to feel the same. So you really need to just optimize resting. So for at least 5 days in the bed. You can consider a postpartum doula. Postpartum doulas, they can bring food, they can clean for you. They can also do belly binding, massaging. They also have tools for them to make sure you have the right temperature and your blood pressure is in the right place, so they can notice any signs that you may have that may be an emergency. You can consider a night nanny to help you get some sleep. Or you can appoint a family member that's willing to do these things for you, or to come and hold the baby and feed the baby so you can optimize your rest and sleep. But also, when you're making a plan for people to come help you, always consider people who are actually willing to help you do other things and not just hold the baby. I know that's a big thing in some cultures. Oh, I want to see the baby, I want to hold the baby. But we need someone to hold the mother. So we need someone who's going to come over and take care of mom too, because you're new as well. Every time you birth a baby, you are new. Also think about what boundaries you want to create, if any. I like to tell my clients to put a nice little note on their door with things they don't want to set, because some people cannot speak up for themselves to set these boundaries. So a nice little note on the refrigerator or the door, like wash your hands before you hold the baby, how many visitors you want at a time and at what times. If you don't want them to post your baby on social media, making sure people wash, I think I said wash hands before they touch you, before they touch you or the baby. Remember to take moments for yourself, even in postpartum. So you're able to take a bath, warm showers. You're able to stretch a little bit. That's considering you don't have any incisions, and you can do a little stretch in the mornings or at night. Another thing I would suggest is building a postpartum cart. So this cart will have all the things you and your baby need, your immediate needs in reach. So this cart, maybe it can have wheels and it can go from the bedroom to the living room, so you're not traveling too far, but just have it set up wherever you're going to be resting and taking care of the baby for the day. So you can have things on there like diapers, bottles, pacifiers, postpartum pads, your perinatal bottle, medicine, water, snacks, just so you're not getting up looking for things and you don't have to call people to bring you things. It will be in your immediate reach. So yeah, here are some other resources and support to seek postpartum. Next slide. Okay. Meal prep service, I said pelvic floor therapist, a mental health therapist, a postpartum doula, a massage therapist, a chiropractor for mom and baby. Does anyone have any questions about maternal mental health or postpartum or other resources? Or any comments? I want to jump in.
Yeah, you could stop sharing this screen now. Thank you. That is the conclusion of our presentation, but we are more than welcome to open up the floor for any moms. I know someone also, I think two of you guys came in during the second half. So if you feel like there's some questions that you didn't get to see, please feel free to come off mute or comment. And then also I'm going to put this email in here again, but please send us an email. I have a list of everyone that joined, but please send us an email with your mailing address so that we can send off your perinatal care package and also schedule your free birth planning session that you will have with one of the lovely instructors you've seen today. But if no one has any comments or questions or concerns, that wraps up our presentation for today. And we thank you all for coming in and taking your Saturdays for a couple hours to listen to childbirth education. But I do hope that you all learned a lot and got some answers or got some questions answered. And if you do want more personal one-on-one time, you could do that during your free birth session where they could answer some more questions for you all and help